All right, chances are if you clicked on this video based on the title and the thumbnail, you are potentially a runner that is looking to increase their mileage without suffering an injury, or you have already unfortunately experienced some kind of injury and you're looking to get back to running or prevent this injury from getting worse. My name is Brad Logue. I'm a physical therapist and the owner of Top Tier Physical Therapy. And in this video, we're going to go over some simple exercises you can do at home without any equipment to either address a pain you may already be suffering from or minimize the chances that a pain will onset despite you increasing your mileage on a week-to-week basis. As you may suspect, most running injuries occur from the waist down, as my lower extremities are the most involved joints in running. So we're talking about hip issues, thigh, knee, shin, and ankle. So we're going to work our way down from each joint, but most of these exercises are going to be multi-joint. So something that I'm going to work on for my hip is likely also going to help my knee and my ankle. Because running is mostly a cycle of jumping and landing on one leg and the other while propelling myself forward, most of the exercises we're going to do are going to be on a single leg to hopefully mimic running as much as we can. So we'll start with our hip and work our way down. All right, so the first exercise, you're just going to need something that mimics a small step. This could actually be a step in your home, or it could be a curb somewhere around where you do your running. It's a lateral step down is what we're going to be going over here. There are two different ways we can do this movement, one that's going to bias our hip and one that's going to bias our knee. So for the first version to bias our hip, virtually what we're doing, we're floating one foot off of the step or curb, and I'm tapping my floating leg down to the floor. You want to imagine there's an egg under your foot. You want to tap that egg, but not crack it. The way we're going to bias our hip with this movement is we're going to go through a little bit more of a hinge. So if I imagine something is in front of my knee, preventing my knee from going forward, that's going to make me do more hinging through my hip and load my glutes a little bit more, which are very important for stabilizing the pelvis as I'm going through my running. So preventing my knee from going forward, I'm going to hinge over, feel almost like a stretch in my glute here, and then squeeze to stand back up. So I'm emphasizing pushing my hips back while preventing my knee from shooting forward. So again, this is working on glute med, glute max, which are very important during the stance phase of my running to stabilize that pelvis and prevent my hips from shooting out every time I land. The other version of this that's going to bias my knee more is where we are letting the knee drive forward. This may be more mimicking of a forward step down, but nonetheless, you could still do this from a step or a curb. So again, floating that floating foot is going to tap the egg without cracking it. However, now instead of pushing the hips back and keeping the knees back, I'm now going to let my hips and my knee go forward. So a little bit more of a forward step down motion here. This one should feel much different than the first variation, where now most of the forces and the strain I'm feeling is through the front of my knee. Again, quads are very important for absorbing the force through my knee as I land on that foot before propelling myself forward in running. Next, we're going to move to some lower extremity exercises that aren't necessarily focused just on the hip or for the knee. They're more functional movements that are going to work on both. So all we'll need for this one is some kind of piece of furniture like a couch, kitchen chair, ottoman, something that's going to support your weight in case you had to sit on it. First one we're going to do is a single leg sit to stand. So just like it sounds, we are just going to stand up and sit down from one leg. So whatever my stance leg is, I'll plant that one on the floor, kick my floating leg out, and from here I'm going to stand and then sit with a nice controlled pace. What I don't want to do is stand and then just kind of plop down onto the seat. You want to have a nice controlled descent there. If that's too challenging, or if we're someone that's kind of already dealing with pain and that just feels like it's too much on our knee or our hip, what we can do is kickstand our floating leg. So instead of having it up in the air, put that leg on the ground, let it absorb some of your body weight while keeping the majority of it on your stance leg. And we'll just go through the same sit to stand movement. Next one's going to be the Bulgarian split squat. It's a very popular exercise with a lot of PTs and a lot of personal trainers. It's a very good exercise. To set up with this one, starting in a seated position, whatever leg you're going to work on. So if I'm doing my left leg, kicking that foot out, being on the edge of the chair or whatever I'm sitting on. You don't want to be all the way back. Get right up to the edge, kick that working leg out, and you're going to stand from here. Non-working leg can go back onto whatever we're using at home, and I'm going to go down through a lunge position. So kind of like the lateral step down we did earlier, this one we can bias the hip or the knee if we wanted to. So to bias my hip, just like I did with the lateral step down, I want to prevent my knee from going forward and have more loading through my hip. So I'm going through a larger flexion moment here with my hip, and then I'm driving through my heel, squeezing my glute to stand up and finish the movement. If I wanted to bias my knee more, I might scoot my foot a little closer. Now when I go into this split squat, I'm going to push my knee forward. So again, just like the lateral step down, more knee over the toe is going to load my knee more. I'm going to push through my forefoot a little bit more versus my heel to load the quads more. So working on the glutes here and the quads to help with pelvic stability in the stance phase, and also help with the shock absorption and propulsion in my knee while I'm running. As we continue with the exercises that are going to help both our hip and our knee, we've already worked on the front of our thigh, more working on the quads, while also simultaneously working on our glutes. Now we're going to work on our hamstrings while simultaneously working on the glutes. So hamstring is going to be more important in that swing phase of our running cycle, especially as we start to increase our speeds. Really, the hamstrings are slowing down that knee extension as we are striding forward. So unfortunately, this is a pretty common injury in a lot of sprinters. They're having much more or much higher muscle activation forces because they are moving their legs so quickly, and a lot of times they can get that hamstring strain as they're trying to slow their foot down from getting out in front of them. So for this one, we're going to use the single leg RDL. You need no equipment for this at all. If you want to challenge the stability a little bit more, or even work on strengthening of your foot, you can do this one in bare feet. I'm going to demo the movement first and then describe it because it's a little bit easier to do that way. So for the single leg RDL, I'm hinging over, and as my trunk comes down to the floor, my floating leg is going to kick up towards the ceiling. So a little bit of a bend in my standing leg. As my chest falls to the floor, my heel comes up to the sky. A few points of performance with this one. For one, you want your stance leg to be a little bit bent, so we're not locked out straight during this movement. A little bit of bend in that stance leg. The leg that's kicking up to the sky, it's following as the chest goes down to the floor, the leg is going to kick up to the ceiling. You want to imagine you have a rod going from your shoulder to your heel. Everything is in a nice straight line. I'm not getting into this rounded position where I'm kind of rounded through my low back. My chest is much further down than my heel is up. Changing planes with this one, we also don't want to see this rotation of our pelvis as we come down. That's going to work a different part of our hip and less of our hamstring. So instead of opening up, we want to work on keeping that hip down towards the floor as we go through that single leg RDL. So again, working on the glutes to help with stability of the hip and the pelvis in the stance phase of running, and then working on those hamstrings to help the eccentric phase or the slowing down of the extension of my knee as I'm striding forward. Okay, continuing to move down the chain. So we've done the hip, we've done the knee. Now we're going to work on our shin/ankle. A lot of the muscles in our shins will run down to our ankles as tendons. So working on these exercises are pretty much going to hit both of them. The most active and most important muscles are actually in the back of my shin while I'm running, and that is my calf muscle. So that makes up my gastrocnemius, which is a little bit higher up, and then my soleus, which is much lower. Most people, when they get that calf soreness after running, they're more sore in their soleus than they are in their gastrocnemius because that muscle is more active while we're running. But nonetheless, it's important to strengthen both. So we're going to do this with simple heel raises, and we're going to change the angle of our knee to target the different muscles. So for the first one, we're just going to go through single leg heel raises, keeping my leg locked out straight. So my stance leg is completely locked straight, squeezing my quad to keep it that way while I'm coming up on my toe as high as I can. All right, so not baby heel raises here. If we can, getting up nice and high. And then we could take it a step further and make it more challenging using that same step or curb as before. We'll just put our half of our foot up on that and allow that heel to drop down as far as it can before we come up into the heel raise. So that's going to work more on the gastrocnemius. So legs straight, we're thinking gastrocnemius. Now we're going to go to a bent knee, which is going to work more on my soleus. So we're going to do the same thing. We're going to do a heel raise, except now instead of having my stance leg straight, we're going to bend it and go through a heel raise this way. So as I, again, try and get as high as I can with this heel raise, should be feeling this in a little bit different part of my calf. So the straight leg heel raise, higher up in the calf in the gastrocnemius. The bent leg is going to be lower in the soleus. Just like we did with the straight leg, we can keep a bent leg off of a curb, let that heel sink down as far as it can, and do a heel raise that way, simply just working through a further range of motion with this. So that's going to take care of the muscles in the back of my shin. Now we're going to transition to the front, which is my tibialis anterior. That muscle's primary role with running is to slow my toes down as my heel hits the ground. So as I'm running, my heel is going to strike the ground and my toes are going to fall down so my foot becomes flat and then I'm in my stance phase. The tibialis anterior is going to slow that motion down so I don't get this foot slap every time my heel hits the ground. This may be a contributor to shin splints. Usually that's the tibialis posterior muscle, but the tibialis anterior can contribute to the discomfort that you may feel in the front of your shin. So kind of in the front, maybe a little bit more towards the outside even. Here we're going to go the opposite. So we did heel raises for the back of our for the back of our shins, and now for the front of our shins, we're going to do toe raises. Rather than doing them standing and allowing myself to just rock back and forth, I like to do these up against a wall. And now I have prevented myself from swaying backwards and I can go through my toe raises this way. If you have a more soft soled shoe on, this might be a little bit more challenging, especially one that has a little bit of a slant to it. So you may want to try something flat-footed or just barefoot. Take your shoes off with this one. All right, and then last but not least, as we mentioned in the previous section of this video, we're going to work on the tibialis posterior. Tibialis posterior is a muscle that's deeper inside of my calf, on the back side of my shin bone, and it actually runs all the way down as a tendon around this bone in my ankle and into the arch of my foot. If we are someone that is running in maybe a minimalist shoe that we haven't really trained for, if we are someone who has a collapsing arch, or we don't have sufficient arch support from our shoe, that is going to stretch that tibialis posterior tendon on a consistent cycle every time my foot hits the ground. So my foot naturally goes through what's called pronation as it hits the ground to help with absorbing force. But if that muscle is weak, it's going to do a bad job of slowing that pronation down, just like the tibialis anterior slows down my foot hitting the ground. The tibialis posterior is going to slow down that arch dropping to make it more controlled. If it's weak and insufficient in doing its job, it's going to get worn out, and that's when people can start to experience shin splints. So as it is a dynamic arch supporter, we are going to use a simple arch raising exercise to help strengthen this muscle. So simply, I'm going to take my shoe off, foot's going to go flat on the floor. Without curling my toes or rolling my ankle and shooting my knee to the outside, I want to try and raise the arch of my foot. So it's a little hard to see here. I'll show a zoomed in version of it as well, but I'm keeping my foot flat and I'm working on raising the arch of my foot. You might notice a little bit of a rotation to your shin here. That's kind of what we want to see. So it's going to look like your shin's kind of rotating outward as your heel raises. As your arch raises. So a closer up version, it'll look like this. You can almost see my tibialis posterior tendon poking out there a little bit as I go through that arch raise. So again, this is going to be one that helps with stabilizing the arch of my foot as I go through running. It's a big proponent with shin splints, so we want to make sure this muscle is nice and strong, especially as we start to increase our running distance. So there you have it. Those are some of my favorite lower extremity exercises to prescribe for runners that are either looking to increase their distance without injuring themselves, or to come back from an injury, or even overcome an injury while increasing mileage throughout the week. With these exercises, they are not magical exercises. So if you do them once, it's not going to fix anything. You got to consistently do them. So I would maybe find a way to work them into either your warm up routine, your cool down routine, or if you're doing strength training, which every runner should be strength training, figuring out a way to add those into your programming. With a lot of these exercises, if you want to work on that foot strength as well, especially that arch strength, like we talked about in the last section of this video, maybe a good idea to try a lot of these without your shoe on, just to make those foot muscles work a little bit more to stabilize your foot and ankle versus having the shoe do that. So hopefully these are very helpful for any of you guys out there that are avid runners, but maybe don't have access to a gym. If you do have access to the gym and you want to make these a little bit more challenging, feel free to hold on to a couple of weights, dumbbells, barbell, kettlebell, to make this a little bit of a progressive overload, and something you can continuously work on by and make more challenging by adding weight. So if you guys have any questions, please let me know in the comments below, and I will see you in the next video.